What's up, everybody? My name is Ben Cohen, and I own Excel Chiropractic in Atlanta, Georgia, specifically Sandy Springs. So I'm excited to talk with you guys today, go over a few of these questions. I'm going to be looking up at the screen here for you because I have the questions that we're going to go over. But yeah, that's just a little introduction telling you who I am, where I am. Also, in terms of chiropractic, there's a lot of different types of chiropractors and a lot of different positions. So you can be an associate chiropractor working for another practice under another head doc. You can be with an organization or a sports team, like a professional sports team or something like that. Me personally, I love chiropractic because I was able to be a business owner as well as a chiropractor immediately right out of the gate. So I own my own practice. I started this practice after graduating about 9 years ago now, and we are rocking and rolling ever since. In a nutshell, what does chiropractic do, or what is a chiropractor for someone unfamiliar? Chiropractic, it's an amazing profession, and it's new in terms of medicine and healthcare and helping people. Medicine's been around for thousands of years. Chiropractic, less than 150 years. So it is more about helping the body function at its best. And the way to do that is by making sure there's no interference in the nervous system. What is interference in the nervous system? That is when your spine gets misaligned, starts putting pressure on your nerves, and because of that, your body doesn't function properly. So how does the body get misaligned? We usually talk about the 3 T's: trauma, thoughts, and toxins. It can be from a major or minor trauma, such as getting in a car accident or sitting hunched over your computer all day. It could be the thoughts and stress and deadlines and things like that get us all out of whack, causing what we call like psychosomatic pain, meaning your mind causing body pain. Or it can be toxins. It can be the air we breathe, the food we eat, the medications that we're ingesting, things like that. So when our body is faced with any of those 3 T's, which most of us are on a daily basis, then our spine might get misaligned, causing problems in the body. Chiropractor's job, what I do, what thousands of others do, is we find where those misalignments are in the spine, gently adjust them back into place so that there's no more pressure on those nerves and your brain can talk to the rest of the body comfortably, naturally, and how it's supposed to. What's a typical day like for you as a chiropractor? And again, this might be different for a lot of people. I honestly see myself more as a business owner first and a chiropractor second, meaning I need to keep an eye on the big picture and not just kind of jumping on spines all day long. So for me, there's a lot of checking in on the business in the morning, making sure things are running smoothly. Then, of course, there's the patient time. We see a lot of patients here, average about 250 to 300 people a week. So we're seeing anywhere from 60 to 90 people a day. So there's a lot of moving pieces. I need to make sure that my team is functioning properly, that everyone knows their role, knows how to do their job, kind of like a Bill Belichick for the Patriots, just everyone do your job. When everyone does their job, everyone is able to work efficiently, and we're able to help as many patients as possible in the most effective way possible as well. So the day-to-day is really just kind of keeping an eye on the business, working on it and in the business. On the business, meaning making sure we're hitting our goals, making sure we're looking at growth. In the business, meaning that we're helping people effectively and helping get rid of pain, or just helping them maintain that healthy lifestyle. What are some of the most rewarding aspects of being a chiropractor? Then one of the biggest things that I love about chiropractic is that it can be instant, right? You can see instant pain relief on that visit. And that's one of the things that really brought me to chiropractic, was that we're not sending them to CVS or Publix or a pharmacy or somewhere they need to fill a medication or a prescription to then hope that they get better from that prescription. They're coming in with a problem. We're finding that misalignment. We're adjusting it, getting rid of that pressure, and usually they're starting to feel better that day. Is that always the case? No. Sometimes people are in a lot of pain, so they have some soreness for a little while. But once we really start taking care of that and having a good game plan, we're usually able to get rid of that pain 100%. So one of the best things I love about being a chiropractor is just helping people on a day in, day out basis and really being that change that they need. In terms of being a business owner, some of the most rewarding aspects there are you create your own future. There's no boss telling me what to do. There's no ceiling to what I can do, how many people I can help, how much money I can make. We have to, not thinking about salary and money is pretty naive. So it is a big risk to run your own business, but one of the best things is that it's a direct correlation. As much work, as much heart I'm going to pour into it, I'm going to see come back to me as well. Some of the biggest challenges: being your own boss, right? Sometimes it's nice to think about just having a 9 to 5, clocking in, clocking out, getting a paycheck. And that's great. And a lot of associate chiropractors who do that love it. They can help a ton of people. They don't have to worry about getting into the weeds, because there are a lot of tough days, months, years when you're in practice that it might not be as, rainbows and butterflies as you hope it is. So if you keep the big goal in mind, the big picture, and you know what you're doing, and more importantly, why you're doing it, you're usually going to end up being very successful. It's up to you to define what success is. Maybe you run a not-for-profit, maybe you run a free clinic, and you find a new way to make money, but you're able to help people that need care and aren't able to afford it. That sounds pretty successful to me. So yes, there are big risks, but yes, there are huge rewards. And like anything else, it's a lot to bring that same commitment every day and to keep your team motivated and everyone rowing in the same direction. But when you have the right leadership and you're able to do that, you're gonna see it pay off tenfold. What advice would you give someone interested in pursuing a career in chiropractic care? Talk to chiropractors, right? Throw your ego aside, look at someone who's doing something that you want to do, look at someone who's successful in a field that you want to go into, talk to them, take them to lunch. It'll be one of the best investments you make, buying them a $20 lunch. So I think that if you are interested, know that you're going against the grain. Know that you are not going to be the typical medical model, and that's okay. We need atypical out there. So knowing that you're going into a profession that might not be the majority and might not be what most people were brought up with can seem like a barrier, but I see it as an opportunity. It's an opportunity for us to help people that are getting addicted to medications, that aren't getting out of pain, who have seen every doctor, tried every pill there is. You could be that answer for them. So personally, I was always the kid growing up who, I don't want to take Tylenol if something hurts. I don't want to take it. And just kind of enmeshed with my personality more, that was how I felt personally. So I think that it's important for you to keep that in mind, that there are going to be some barriers and obstacles. There might be some doctors that don't love you and don't want to refer to you, but that's their problem. I refer to a ton of medical doctors, a ton of surgeons, a ton of neurosurgeons, a ton of psychiatrists, whatever it may be. When everyone stays in their lane and works together, that's when the patient gets best. Don't get into this. Don't get into chiropractic. Don't get into any field to just be called doctor. If that's why you're getting into it, to be Dr. Cohen, you already lost. You got into it for the wrong reason. If you're getting into it to help a lot of people, chiropractic is a great way to do that. Another thing that's awesome about chiropractic is if you did have dreams or aspirations of being a business owner, there's no residency afterwards. You don't have to go work in a hospital for 4 to 10 to 20 years before getting a shot at that. You can go out, hang your shingle the next day if you want. Is it easy? Absolutely not, but nothing's easy. Again, however much you're willing to put in or however hard you're willing to work, you're going to see come back. So how can chiropractic complement traditional medicine for a more holistic approach to health? Kind of like what I was talking about. If you shatter your leg skiing, please don't come to me to get adjusted that day. Please go to the urgent care emergency room. When everyone works together, that's when the patient gets the best results and the best outcomes. So one of my sayings that I tell people, I always say, do what you do best and refer for the rest. I think that's great advice, because especially first coming out of school or first becoming a chiropractor, you're going to want to do everything. You're going to want to help everyone, and it's just not realistic. You need to know who is your ideal clientele, what conditions can you help best, focus on that. Yeah, maybe it limits you at the beginning. You're not seeing as many people as you could, but that won't be the case for long. When you try and do everything, when you want your menu to have 20 different cuisines, it never turns out well. Be the best at Italian food. Have the best burger in town. Be the best chiropractor for sciatica. Be the best chiropractor for carpal tunnel syndrome, whatever it may be. Try and do what you do best. And if you have someone come to you needing help and you're not the expert there, they will respect you more and come back to you if you get them to the expert. They'll get that issue fixed with that person. They'll come back to you for something else. Don't try and win them all, because you're just going to end up hurting your brand and hurting your reputation. And looking back, what could I tell my younger self about choosing a career in chiropractic care? Good choice. Smart move. Right? I knew that I wanted to be a business owner, like I already mentioned. I knew that I wanted to help people. This just went hand in hand. I was able to run my business. I'm able to help thousands and thousands of people, and I'm able to go home at the end of the day with my own hours, see my family, see my 2 daughters, be with my wife, and have a really great life. So for my younger self, I would tell him that stay with it. It's not going to be easy, but it's going to be worth it in the end. So if you guys have any questions, I know you're taking this course right now, you're learning a lot. I hope this shed a little light onto chiropractic care. If you ever need anything from me personally, you can always reach out to me. I know I might be further down the totem pole for who you'd ask for advice, but still, I am a resource. I am in Atlanta, Georgia, if you need anything in this area. Again, my name is Ben Cohen with Excel Chiropractic. My email address is excelchiroatlanta. That's EXCELCHIRO Atlanta @gmail.com. Do not hesitate to reach out to me if you need anything. Thanks a lot.